Let's go through the steps together. S is for stimulate. Try to wake them up by calling their name or providing a sternal rub. Are they responding to pain or noise? No? Call 911 immediately. When you're talking to 911, answer the dispatcher's questions briefly and clearly. Tell the dispatcher that the person is unconscious and not breathing, and when they arrive, tell them as much as you know. A is for airway and V is for ventilation. If the person is unresponsive and not breathing, initiate rescue breathing immediately. Place them on their back and tilt the chin up to open the airway. Check to see if there's anything in their mouth or blocking the airway. Use your barrier mask if you have one to cover their mouth. Plug the nose with one hand and give 2 even regular-sized breaths. This should make their chest rise. If you don't see their chest rise, tilt the head back more and make sure that you're plugging the nose and covering the mouth with the mask. Give 1 breath every 5 seconds for 2 minutes. E is for evaluate the situation. If no response after rescue breathing for 2 minutes, then administer naloxone. Naloxone is also known as Narcan, and it is a prescription medication and should be dispensed in conjunction with overdose prevention training. It is an opioid antagonist that prevents or reverses the effects of opioids by blocking the opioid receptor sites in the central nervous system. It is a safe and effective antidote to opioid overdose, and the only contraindication to naloxone is hypersensitivity to naloxone. It has no pharmacologic effect when used in the absence of opioids. It only works on opioid overdose. It may produce withdrawal symptoms, and although uncomfortable, withdrawal is not life-threatening. It has no potential for misuse. It does not get a person intoxicated, stoned, or high. It is not effective when taken orally and should be administered parenterally. Onset of action is 2 to 5 minutes following an IM injection and has a half-life between 30 to 60 minutes. It should be stored between 15 and 30 degrees and protected from light. M is for muscular injection of naloxone. Remove as much clothing as possible to expose the upper thigh. Divide it into 3 equal parts. The middle third is where the injection will go. Remove the cap from the vial and clean it with a swab. Insert the needle and draw up 1 milliliter of naloxone, which is the full vial. Remove any airspace. Insert the needle at a right angle, so 90 degrees, into the muscle. Push the plunger down slowly and steadily until empty. Remove the needle at the same angle and dispose of safely. Keep the vials for EMS so they can see what was given. E is for evaluate again. Naloxone takes effect within 2 to 5 minutes, and after giving the first dose, unless a person is awake and breathing normally on their own, continue rescue breathing for another 2 minutes. And if they're still not responsive and breathing adequately on their own, give the second dose of naloxone. Continue rescue breathing until they are breathing on their own or until help arrives. And when the naloxone kicks in, the person may be disoriented, agitated, and angry and want to use drugs again. Try to explain to them what happened, tell them EMS is on the way, and urge them not to use. And stay and monitor the person until EMS arrives. And remember, if you ever have to leave a person alone, put them in the recovery position. If the person, or you need to leave them, put them in the recovery position. This will help keep their airway open and prevent them from vomiting and choking. And if you can, please wait for EMS to arrive. If a take-home naloxone kit is used, advise the client to return to the location where they received the kit or to call 811.
Question the statement, unresponsive and not breathing. Start rescue breathing. Any patient in coma, cyanotic, shallow breathing, less than 12 breaths per minute, rescue breathing essential.